right, so welcome to our second in a quarterly series of age-friendly presentations on the 4Ms. I'm going to take over for a second, Heather, and just share 4 quick slides to give people an introduction to what the 4Ms are. Can you see those slides there?
We can.
Okay, perfect. How we're going to be addressing these each quarter. Our first session back in March was on mobility, fall prevention. This session today will be on the mind and brain health. And then in September, we're going to have a session on medications. And then our last session in December will be on what matters most. So I just wanted to review again what age-friendly health systems actually mean. So we are an age-friendly designated level 2 healthcare system at Levine Cancer in our supportive oncology department. And this was a partnership between the John Hartford Foundation and the Institute for Healthcare Improvement, along with the American Hospital Association and the Catholic Health Association. And they came up with guidelines around age-friendly, evidence-based practices that we would cause no harm, of course, but then we were going to be focusing on aligning with what matters to our older adults and their family members. And so the age-friendly healthcare systems are built around that network of 4Ms that I had mentioned to you, meaning mentation or the mind, what we're going to be talking about more today, with mobility, which we had talked about in March. And there is a recording if anybody's interested in that. I'm happy to get you the link to that. Medication, knowing that our older adults are typically taking more prescribed or over-the-counter medications than younger folks, and then really what matters and how you can make health decisions based upon what's most important to you. And so again, we are really proud to say that we are a level 2 designated age-friendly healthcare system, both at this location, at the Moorhead location, and at Pineville, and we're working on adding additional locations to that and addressing the criteria so that we can provide the best care possible for our older patients. So I'm going to stop sharing, and I'm going to hand this over to Jill. Jill is going to introduce our speakers. And again, I will turn my camera off while y'all are presenting, but I'll be monitoring the chat. And so feel free to put in any questions, and I'm happy to help with that. And thank you for joining us today.
Good morning. I just want to welcome Dr. Heather England and also Dr. Jennifer Hartzell. Dr. England is a board-certified clinical neuropsychologist. She completed her undergraduate degree at UNC Charlotte and her master's and doctoral degrees at Georgia School of Professional Psychology in Atlanta. She completed her internship and 2-year fellowship in clinical neuropsychology at Bay Pines, Virginia, in Bay Pines, VA, in St. Petersburg, Florida. She joined Levine Cancer in 2020. She's a Charlotte native and proud mom of son and daughter. Loves reading and sitting on the beach. And then Dr. Jennifer Hartzell is a board-certified clinical neuropsychologist specializing in the assessment of neurocognitive disorders in oncology patients. Dr. Hartzell began her career at NYU and relocated to Charlotte in 2017 to develop Levine Cancer Neuropsychology Service. Dr. Hartzell remains active in inpatient and outpatient clinical care, research, and education. Specific interests include preoperative consultation, assessment, and treatment planning for primary brain tumors. Outside of work, Dr. Hartzell can be found chasing after her 2 boys. So thank you very much for taking time with us today, Dr. England and Dr. Hartzell.
Thank you, Jill.
Thank you, Jill. Hello, everyone. We're excited to give this chat. So we're going to be talking about cancer and brain health today. So let me get it to progress. I'll have to do it like this. So what we're going to do is we're going to define normal cognition and normal aging versus dementia. We're going to explain chemobrain and provide some brain tips for brain health. And then our goal today is just to increase our understanding of cancer-related cognitive impairment and to stimulate some discussion. So I'm going to give you some key terms. So cognition is our thinking abilities, our memory, our attention. It's a broad statement to capture all of our thinking abilities and our brain function. Cognitive is how our brain works, so our cognitive abilities, how our brain is working. Neuropsychology, which is what Dr. Hartzell and I do, it's the study of brain function, our cognition, our behavior, and the relationships between the structures in our brain and how our brain is functioning. And then if you have a neuropsychology evaluation, this is a non-invasive objective testing that's designed to help measure your cognitive abilities, where your strengths and weaknesses are. If you have any impairments, this is used to help with diagnosis and treatment recommendations. Normal cognitive aging is the process in which some of our cognitive abilities gradually decline over time, which is normal. And then we have cognitive impairment, which is abnormal. This is a deficit in your thinking skills that's measured. It's a statistically significant deficit, meaning that if you perform poorly on memory, we're going to compare that to other adults your same age and education and see how you're performing against them. That would be a cognitive impairment if it is, in fact, impaired. Dementia is a term that's used to describe progressive cognitive impairment plus functional decline, and chemobrain is the effect of cancer and cancer treatment on the brain itself. And this term is reserved for cancers that are outside of the brain itself. So not primary brain tumors, but something like breast cancer who's treated with endocrine therapy or chemotherapy. So let's talk about normal cognitive aging. Gradual cognitive decline is in fact normal. And it can be broken down into two different cognitive abilities. We have our crystallized abilities and our fluid abilities. Our crystallized abilities are those things that remain stable. These are the things that we've learned or overlearned, we've practiced, they're very familiar. A crystallized ability is like that recipe that you've cooked 1,000 times and you no longer need the recipe card anymore. It's a crystallized ability. Or general knowledge, like who was the president in such and such year when you voted for the first time, or who did you, this generalized knowledge. Or vocabulary knowledge is something that is crystallized. This either remains stable or improves with age, like your vocabulary is constantly growing. And so this is something that remains stable. Fluid abilities, however, is something that declines gradually over time. This is the ability to learn and process new information, to solve unusual problems, or to attend to information. So for example, our processing speed naturally declines over time. Forming new memories, the ability to form new memories gets harder to do over time. Our fluid abilities peak in our third decade of life and then slowly decline from there. So I gave this chart of what is normal aging with respect to memory, because everyone thinks if they have some memory decline, then, oh no, they must be getting dementia, and that's not the case. You can see on the left-hand side that things like delayed free recall, source memory, and perspective memory, those decline with age. Whereas other things like recognition memory or temporal order memory or procedure memory stay stable. I like to give this example. If you're going to the grocery store and you had a list of items, when you go into the grocery store, you're most likely not going to remember that whole list of items. That's delayed free recall. But if you walk into the dairy section and you see milk, you'll say, oh yeah, I need to get milk. That's recognition memory. Those things stay stable, whereas delayed free recall changes. An example of source memory is when you hear information and you can't remember, did I hear that from a friend or did I hear that from TV? That's source memory. You know this information, it's just not quite sure where it's from. And perspective memory, this is the thing like remembering to remember. Remember to pay the bill on time, remembering to take your medications. If it's not overlearned and a good routine, that's going to decline with age. Fortunately, your temporal order memory stays the same, and your procedural memory, like how to ride a bike, that doesn't decline over with age. So what is the difference between normal cognitive aging and dementia? Normal cognitive aging, as I described, is a natural process, and it's going to happen. Whereas dementia is a degenerative condition, meaning that it gets worse over time. Dementia is caused by diseases to the brain, and all aspects of our mind and our behavior can be affected. So our memory, our language, our temperament, our ability to engage in social interactions, all of that can be affected by dementia. And in addition to changes in our brain and cognition, our functioning is impaired. And that's what actually qualifies you for the diagnosis of dementia, is the combination of both things. So this results in a loss of independence in things like managing your medications or your finances and even driving. And over time, as the disease progresses, individuals can lose their abilities to care for even their basic needs. So I'll turn it over to Dr. Hartzell now.
Thank you. All right, so now we're going to talk about chemobrain and how chemobrain is unique from both normal cognitive aging and dementia. All right, so just historically, I wanted to provide some context about chemotherapy and how the concept of chemobrain evolved over time, because it's a relatively recent construct. So following both of the world wars, so World War I and World War II, where nitrogen mustards were used as chemical warfare, affected individuals in certain communities were studied. And it was observed that these patients had, or these individuals had changes in their blood counts and reduction of tumor sizes. So that led to the use of nitrogen mustards and mustine as an agent to reduce tumor size. At first, when chemotherapies were evolving, the medical community attributed any cognitive impairment that was perceived following treatment to be related to either fatigue or mood disturbance, which indeed are two constructs that can influence your cognition. It was believed at the time that chemotherapy to the body did not cross the blood-brain barrier, and therefore any neurotoxicity that resulted could not necessarily be attributed to the chemotherapy. It wasn't until the 1980s, really, when there were some studies, a host of studies that were done at Dartmouth, where they showed that there was a significant association between cognitive impairment and multiple chemotherapy drugs in patients that were not depressed, not anxious, and did not have CNS cancers. So this led to the idea that there is probably some relationship between the drugs and cognitive changes. Research then throughout the 80s and 90s continued to support the neurotoxicity of chemotherapy. They even showed that higher dose chemo was more neurotoxic than standard dose chemo. Chemobrain as a construct itself was was coined essentially by cancer patients and survivors who felt that they had, mental fogginess and slowness following treatment. And the term itself didn't enter the scientific literature until 1999 in the journal Coping. Tim Ailes and his colleague wrote the following: some of the most common thinking problems that may be attributable specifically to chemotherapy include difficulty with concentration, memory, the ability to be focused or organized, and working with numbers. These problems are usually quite subtle. Very often, only the survivor recognizes the difficulty. And that's especially true. You can advance it. So chemobrain currently refers to the phenomenon of cognitive changes occurring before, during, or after cancer diagnosis and treatment. Although it was previously conceptualized to be a subjective state, the research that we've discussed, since the 1980s has shown that chemobrain as a phenomenon can be measured objectively through neuropsychological testing as well as neuroimaging. We see, on brain scans, reductions in gray matter, changes in the architecture of the white matter within the brain. So it's clear that there is an objective component to this phenomenon that patients were experiencing well before there was a name for it. Chemobrain excludes cognitive changes due to brain cancer. And chemobrain may be due to cancer itself, which causes an inflammatory process throughout the body as well as the brain. Could be due to chemotherapy, radiation, hormone therapy, even surgery. So having chemobrain, this disruption within your thinking skills, either before, during, or after diagnosis and treatment, may be due to a variety of factors. Chemobrain is considered to be independent of mood disturbance and fatigue, as those studies that I just discussed showed in individuals that were not anxious, were not depressed, and maybe didn't necessarily have tremendous fatigue. There was still cognitive change, but it is acknowledged within the literature that those factors, mood disturbance, fatigue, even pain, etc., are also pretty common within cancer and can contribute to or exacerbate a pattern of cognitive dysfunction that patients are experiencing. Some of the most common concerns that are reported by patients who experience cancer-related cognitive impairment or chemobrain include forgetting conversations, repeating yourself, asking the same question more than once, telling somebody the same story more than once, having difficulty finding words, that tip of the tongue phenomenon where it's right within your grasp, but you can't quite get it out, misplacing things, losing your keys, forgetting where you put your phone, having difficulty concentrating or focusing, being more distractible, more easily interrupted in your thinking by external distractions within conversations, losing your train of thought, getting sidetracked or thrown off, slowed information processing, problems with auditory comprehension, so understanding what somebody is telling you, as well as reading comprehension, understanding what you have read. Difficulty organizing, starting, or completing tasks, so generally feeling less efficient than you may have previously, and to go along with that, more difficulty multitasking, feeling like you can only do one thing at a time in order to be successful. Our research over the years has shown that short-term memory and executive functions, things like planning, organizing, problem solving, shifting set between one task to another, those are the domains that are most consistently affected in individuals who are afflicted by chemobrain. All right. So as it was described in that journal article from 1999, deficits in chemobrain were described previously as pretty subtle and only evident to the objective observer. That's true to an extent, but in general, we see mild deficits in chemobrain. Chemobrain does not cause significant impairment in cognitive abilities in the way that a neurodegenerative syndrome or dementia might. The severity of chemobrain does vary, however, by age, by education, by the type of cancer, and by the type and duration of treatment that an individual has undergone. So, for example, if two patients have the same diagnosis and are undergoing the same treatment, if one patient is 20 years old and another is 75, the 20-year-old's brain is going to be a little bit more plastic and may have less susceptibility to cancer-related cognitive impairment than the 75-year-old. The duration of chemobrain, how long it lasts, also varies quite a bit. It's said within the literature that many patients, or most patients, return to baseline cognitive functioning after treatment, but it has been shown that up to 60 to 70% have persistent cognitive deficits, meaning cognitive deficits go on after treatment has been completed. And there has been literature, documenting over the last 10 and 20 years that chemobrain can last for a couple decades. We don't know more than that, though, because it hasn't been studied for longer than a couple decades at this point in time. But research should continue to be forthcoming. So there are, as I've alluded to, a bunch of exacerbating factors, things that can make the experience or severity of chemobrain a bit worse. So if there is concurrent mood disturbance, such as anxiety, depression, stress, frustration about how your brain is working or not working to your standards, that can make the symptoms of chemobrain worse. So too can fatigue, difficulty sleeping, which is so critical for your ability to consolidate new information into your memory. Pain, as well as any pre-existing or co-occurring medical conditions, whether they be neurologic medical conditions or just general chronic health conditions, can have an exacerbating impact on chemobrain. It has been shown that depression, specifically neuropathy, and a higher body mass index tend to be predictive of more persistent or enduring cognitive dysfunction. The life impact of chemobrain is often out of balance with the severity of the deficit. So chemobrain, as we said, is typically considered to be a pretty mild cognition in terms of objective standards on testing, but the changes in an individual's life and functioning can be way more profound. Cancer-related cognitive impairment can interfere with one's educational goals, such as like deciding whether to pursue a higher degree, can interfere with occupational functioning as well as career decisions or aspirations for your career, interferes with social and family relationships, family planning, whether it's the right time, to have a child, general lifestyle, self-esteem and identity. I hear a lot about self-consciousness evolving from chemobrain, and it ultimately affects your overall quality of life, how fully you can engage in your life and the activities and people that surround you. So with respect to chemobrain, what can you do about it? You don't necessarily just have to sit and wait for it to resolve. You can talk to your oncologist or your navigator and ask for some education. You can also request a referral to see one of us neuropsychologists for an evaluation. The evaluation can consist of a couple of steps. Typically, we'll start by having a clinical interview with you or a family member about your cognitive concerns, followed by some paper and pencil testing of your cognitive abilities. I had a patient this morning ask me if I was going to put electrodes on his head. I said, absolutely not. There's nothing invasive here. It's just paper and pencil. Feels a little bit like school, and there's some verbal interaction. You're going to be asked to remember things, repeat some items, and you're one-on-one in a room with an examiner. feels a little bit like school, but with this type of testing, there are no grades, and your job is just to give us an honest representation of how your brain is working. Thereafter, your performance is compared, as Dr. England mentioned earlier, to other individuals of your same demographic bracket, in order for us to better understand where there are strengths, where there are weaknesses, where in fact there may be deficits. And then live feedback is provided to you about the results and our recommendations for your forthcoming care. Treatment can come in a bunch of different forms, and we typically end up recommending a multidisciplinary approach. It's most important at the get-go to manage some of the exacerbating factors. So as we mentioned before, things like anxiety and depression, pain, fatigue are things that can make the phenomenon of chemo brain worse. So whatever we can do in advance to eliminate those factors or contribute to some abatement of their severity is beneficial. And that can be achieved through counseling or medication management. Lifestyle interventions are also heavily promoted. A heart healthy diet is something that's also a brain healthy diet, because your brain is so contingent. Your brain health is very contingent on the same things that make your heart work. We also recommend some moderate, reasonable exercise, not overdoing it, moderate mental stimulation, again, not overdoing it, and maintaining a consistent sleep schedule. As I mentioned, sleep is very, very important for your cognitive processes, and in particular, your memory functioning. Integrative therapies are often recommended, such as dietary supplements, things like acupuncture, yoga, mindfulness, and relaxation therapy. And then in terms of behavioral intervention, some of the things that we most commonly recommend include cognitive rehabilitation or cognitive remediation, as well as speech therapy and occupational therapy. I wanted to share with you this study, which I think is really profound. This came out in 2018, so right before the pandemic. It's titled, "A Brief Psychoeducational Intervention Improves Memory Contentment in Breast Cancer Survivors with Cognitive Concerns." So in this study, the authors provided a single, one-time, 1-hour psychoeducational intervention to 100 breast cancer survivors who had self-reported or subjective cancer-related cognitive dysfunction. The intervention was designed to provide education and promote self-management of cancer-related cognitive impairment. So what could these breast cancer survivors do themselves to better manage their cognitive complaints? Participants were assessed by the study team immediately before, immediately after, and 6 weeks after receiving the intervention. So at 3 separate time points. The primary outcome that they were assessing was memory contentment. So how content were these survivors with how their memory was doing? Secondary outcomes included knowledge of cancer-related cognitive impairment, symptom distress, and self-efficacy to cope with chemo brain. What they found was that there were improvements in these individuals' memory contentment immediately after the intervention, as well as 6 weeks later. They also showed that there was significant improvement in their knowledge of chemo brain, their distress about it, and improvement in their self-efficacy or confidence to cope with cognitive symptoms. And so they concluded that a single 1-hour psychoeducational intervention can achieve lasting and improved adjustment to memory complaints in breast cancer survivors. What this means to us as clinicians is that education is so important to our patients in understanding what they are experiencing and as well as rectifying the symptoms. So your symptoms can become less of a focal point as education is received.
So some frequently asked questions that we get. The first one is chemo brain real? Well, I think Dr. Hartzell clearly explained this so far that yes, chemo brain is real, and research now backs up the presence of chemo brain. Will I definitely get chemo brain if I have chemotherapy or radiation? No, you will not definitely get chemo brain. As Dr. Hartzell said, the severity is different for folks, and even the presence of it is different. And those are based on various demographic factors, how well your health is overall. Lots of different things can contribute to the presence of chemo brain after chemotherapy or radiation. How soon will it go away? Well, we've discussed this, that the duration is highly, highly variable. Some people, it goes away completely after treatment. Some people, it doesn't go away and it persists for a long time. What can I do to make it go away faster? I think the biggest thing that I would recommend is these lifestyle and health factors. The more you manage things like mood, fatigue, sleep, and pain, the better you are going to be able to manage the symptoms of chemo brain and help them go away faster. If you're not sleeping well, if you're experiencing a lot of pain, then you're going to have this constellation of symptoms, and that's going to last longer. Will I ever be the same again? I like to answer this with a yes and no. Unfortunately, we cannot take away the fact that you have had cancer. And so sometimes just the presence of this lifestyle change or this life-changing diagnosis can lead to us not ever feeling the same, like the grass is always greener, right? Can your cognition be the same again? Yes, it can be the same again. Like we've said, the duration or the severity can highly vary from patient to patient, but feeling the same as though this never happened, that's unlikely.
Yeah, and that's an unfair standard to measure yourself against. You are indefinitely changed by your experience as a cancer patient and cancer survivor.
Correct.
And so it's unrealistic to think about returning to the same person. And oftentimes we'll idealize who we may have been in the past versus who we are now and consider ourselves to be much lesser. And that discrepancy is often a sure pathway to depression.
Yes.
So we encourage patients to not think about returning to any previous state, but to behave in ways that can promote your improved functioning and quality of life at this point in time, given the circumstances that you have been dealing with.
Yeah, that's great. Do I have dementia? No. Chemo brain and dementia are not the same things. Hopefully this presentation has clarified that. Matter of fact, majority of individuals with symptoms of chemo brain experience very, very mild changes on testing. It feels bigger functionally for a lot of different reasons, but it's not to the severity that would warrant a diagnosis of dementia. Am I more likely to get dementia now that I have chemo brain? So research shows that any neurologic event can increase our risk of dementia over time. It increases our risk of cognitive decline as we age. So in general, having a neurotoxic agent can increase your risk. But does that risk increase drastically? The research says no, that there is a subtle increased risk with after chemo or radiation on changes in cognition over time, like a dementia. But it's not as significant as a risk of something like untreated heart disease that has a higher risk of dementia, or a history of stroke or a history of significant traumatic brain injury. Those risks are higher for dementia rather than chemo brain.
What's also true is that if you are predisposed to a neurodegenerative syndrome, having undergone cancer treatment is something that can accelerate the onset of the disease, meaning that symptoms may evolve earlier, but does not necessarily affect the will I, won't I get it. That's something that can be predetermined by the disease itself.
Right. Our genetics can play a huge factor in that. Will crossword puzzles or online puzzles or online programs help me? I would say yes and no. Cognitive stimulation is incredibly important, and we're going to talk about some tips for brain health, and a lot of that has to do with cognitive stimulation. But this is what I tell my patients all the time. You want to balance cognitive stimulation with frustration. If you're not a crossword puzzler and you go and you say, I want to start crossword puzzles, you may experience quite a bit of frustration in doing the crossword puzzle. This is just not your strength or your wheelhouse. Instead, doing something that helps with mental stimulation that is more enjoyable is actually going to help you better than just going out and buying a whole bunch of crossword puzzles or trying to do the New York Times crossword puzzle on Sundays.
Yeah, puzzles are not necessarily a remedy.
Correct.
But if it's something that you enjoy and provides you with a reasonable degree of stimulation and is not frustrating to you, then it can help. The moment that it becomes frustrating, your brain shuts down and no longer will it help.
Right. And online programs, there's many online programs out there that say that if you do this activity 10 minutes a day, you're going to improve your brain health. The research shows that engaging in mental stimulation improves our mental health, our brain health. And so that's where the correlation between doing the program and brain health kind of ends. The only thing that's a modifiable cognitive ability is our processing speed. We can get faster at doing a particular task, but it's not generalizable. So if we do an online program that makes us do something quickly, then we're going to get faster at that task, but that doesn't necessarily mean that we're going to get faster at getting dressed in the morning or getting to a place on time or completing even our finances quicker. If we work on doing finances quicker, then we may get quicker at finances, right? Because we become more efficient. That's the only thing that's generalizable is if we work on the speed of a particular task. But playing a memory game on an online program is not inherently going to improve your memory for what you just heard in conversation. So let's talk about some tips for your brain health. The first one is slow down, take your time, don't rush. Rushing leads to errors. As I said at the beginning of this presentation, one of the abilities that declines over time is our processing speed. And so this is a natural decline. And so when you are rushing, you're now working against this natural decline, and now you've got a big problem. And so you're more apt to make errors, you're more apt to make mistakes. And this is what I've learned about my patients. When they make a single mistake, they start looking for more mistakes. And as we make another mistake, we start thinking, now this is a problem. In fact, you're human, I'm human, and we're going to make mistakes all the time. And sometimes our mistakes are because of what we're doing behaviorally, not how our brain is working. And rushing is one of those behavioral things that I really want you to slow down and stop rushing.
Take planned breaks. So what this essentially means is you want to schedule some time within your day, within each activity, to pause. It's generally not recommended to keep going and going and going until you burn out. That's going to lead you to feel worse the rest of the day or the following day. If you can space out your activities and give yourself an opportunity to kind of recharge periodically throughout an activity, throughout the day, then your efficiency is actually going to improve.
Give yourself more time than you need. This kind of goes with the idea that I just talked about, rushing. We all underestimate how long a task takes. I'm guilty of this all the time. And what that leads to is that we either rush through it and we make more errors, or we think we're going slow, and so we have a problem now because we're taking too long to complete the task. When in fact, it's a 30-minute task and we only gave ourselves 10 minutes, right? And so give yourself more time than you need. It's better to overestimate and have a little extra time than it is to underestimate and then have to go through all of those what's wrong with me or rushing to make mistakes. So give yourself more time.
work on one thing at a time. Okay, why should we do this? So multitasking is something that actually makes us less efficient. It is a misconception that multitasking is preferred and is, a superpower. Doing one thing at a time, individually to completion, pausing, then moving on to the next, being able to swiftly shift your focus while putting the previous thing to bed is going to lead you to be able to complete things more fluidly and more efficiently.
You actually look like you're multitasking when you complete a task and move on to the next. A lot of people think that that is multitasking, but in fact, no, that's completing a task and moving on to the next. So it's a misnomer. Minimize distractions. This is the time when I want you to cut off the TV, ask the people around you to not engage in conversations while you're trying to do a task.
Shut off social media.
Turn your phone off, flip it upside down, put it in a different room. Because when you have distractions, you're more apt to get into this idea of multitasking. Distractions lead to you having to divide your attention or do two tasks at one time, and that's going to increase our errors and decrease our efficiency. And so turn your TV off.
Distractions are often also inevitable. I mean, our life is full of distractions. You can't always control them. But when you have a specific task that's important to you to complete and to complete it well with accuracy, that's when you want to have more control over your environment. Keep belongings in the same location after use. This is something that I try my best to do. My husband is horrible at it, and I'm always looking for his keys and his earbuds for him around the house. But if you can, the important things that you need to take with you on a daily basis, whether it's your keys, your phone, your wallet, have a home for them, and even initially when you're starting this, this technique, label their home. This is where the phone goes. This is where the keys go, etc. And try and always return them to that spot so that you're not wasting time running around the house looking for the thing that should have been where you labeled it.
This is also great life lessons to teach other people, like our husbands.
Yes.
Leave yourself notes. I have found that a lot of us do this as a part of our careers, but we don't do it at home. So if you go into my office, there are lots of notes for me to do things. And the reason that I do that is it makes me very efficient. I don't have to remember to do it. The note tells me to do it. And it frees my brain up to do things like this, right? Where I can remember these slides or have conversations with patients. Free your brain up by leaving yourself notes. And so if it worked for you in your career, try it at home. And I think you'll find great success by leaving yourself notes at home. The other thing about leaving yourself notes is throw them away when you're done. Sticky notes can become wallpaper. If they just stick at a place all the time, then you stop looking at them. I, in fact, as I was preparing this presentation, looked at a sticky note on my desk and realized that it's something I need to do every Monday, and I have not done it for the past 2 Mondays because that sticky note has now become wallpaper. And so what you want to do is you want to leave yourself a note that's time sensitive, and once the challenge or the task is complete, throw the note away. And if you need to do it again, make yourself another note. But you want to throw away notes or else they just become clutter.
Ask for reminders. It's also not, something to be embarrassed about to ask for a reminder from your spouse, a friend, a family member, whoever it may be, about what you're supposed to do. Reminders can jog your natural recall, and it's not something to be shy about. So go ahead and ask if you need reminding.
Yes. Repeat important information to yourself aloud a few times. This is helpful in multiple ways. One is you're getting repeated exposure to the information. And one way to learn is through repeated exposure. Matter of fact, a test that we give our patients is we have a list of information that we give our patients multiple times. So we want to see, does your memory improve with multiple times? multiple exposures. And yes, everyone's memory improves with multiple exposures. The other thing that you're doing by repeating it out loud is now you've thought about it, you've heard it from someone else, and now you're saying it. You're giving yourself multiple modalities to remember the information. So the information's coming at you in more ways, and you're giving yourself additional exposure. That will, for sure, increase your memory recall.
So too will taking a mental photograph of information. That's another modality, the visual domain. So if you have written down some notes for yourself to remember, spend some time looking at it, where those words are on the page, photograph it in your mind so that you can refer to it when you're not in front of that list.
I like to do this with objects around the house too, like possessions. When I lay down something, I take a photograph of where I'm putting it in the house, so then I can easily retrieve where I've placed that thing. Use a calendar or planner. This kind of goes with using notes. Again, this is something we do in our careers all the time, and we don't think anything of it. But if we have to do it in our personal life, we begin to think that there's something wrong. But there's not. Using a calendar or planner makes you very efficient. It also frees your memory to do other things. It takes something off of your mind that's kind of running in the background. It closes a tab, if you will, like a computer, and it allows you to process more efficiently other things that you want to process. An example is I had a note that was a sticky note of something I need to do every Monday. I realized that wasn't working for me, so now it's in my calendar. So every Monday I'm going to get a ding from my calendar that says, do this task. And so, you want to use these strategies to make you efficient.
This is probably one of the most important recommendations that we have, to set expectations for yourself that are reasonable and achievable. Giving yourself a to-do list that is unwieldy sets yourself up for failure. And that's not the outcome that we want. Giving yourself a few tasks to complete each day, a reasonable amount of tasks that you can achieve in the amount of time that you have set aside, is what we strongly encourage. We don't want you to fall into a situation where you have a laundry list of things that you have to do in a couple hours that may be shortened even by all of the distractions that are going on in the environment. And then you leave the day feeling like a failure because you were only able to check off 2 of those items. Whereas if your list were contained to 2 or 3 items per day, you can get to that achievement place.
Yeah. The other thing to factor into this is the presence of cancer-related fatigue. If you are currently going through treatment or you do have cancer-related fatigue, it is important to set yourself up with these reasonable expectations and realize the adjustment that needs to happen to support your physical health as well.
Mm-hmm. And adding in some of those planned breaks like we discussed before, especially important to address fatigue.
Mm-hmm. There's nothing that makes you feel like a failure more than setting yourself up for failure. And then our last tip is do things that you enjoy to exercise your brain. Again, I kind of talked about this earlier in the frequently asked questions. If you're not someone who enjoys crossword puzzles, don't do crossword puzzles because it's not going to help. It's not going to help. It's going to increase your frustration, and you're not going to get the exercise that your brain needs. But there are many, many, many ways to exercise our brain. It doesn't even have to be sitting down and doing some sort of puzzle. It can be an online cooking class. It can be engaging in conversation. It can be going for a walk. All of these things exercise our brain. When you are thinking, talking, trying to remember something, you are, in fact, using and exercising your brain. So you want to do those things that are enjoyable to you. What's enjoyable to me may not be enjoyable to you, and it may increase frustration. So if you're chatting with another cancer survivor or a family friend and they say, why don't you do X, Y, and Z? It's okay to try it, but if it's not enjoyable and it increases your frustration, then it's not going to work. Okay. So any questions? Is there anything else that you wanted to add, Dr. Hartzell?
I don't believe so.
All right.
This was really informative, both of you. So thank you so much for that. Do any of you have any questions? Jean or Cheryl, you're free to put them in the chat, or you can unmute yourself and ask, or any other resources that might be helpful for you. I especially liked the tips at the end. So things that we can all kind of take advantage of. No matter where we are in life.
That's right.
Yes.
Yeah.
They seem so simple, but they're
Yeah. Yeah.
Distractions.
And so, Jean, yes, we will get the recording to you and a PDF of the slides as well, so that you can have that to refer back to. And Cheryl is typing, so let's just give this a second. Very informative. Thanks so much. Can I also get a copy of the previous? Yes, ma'am. I'll be sure to get that out to you guys. And again, the recording will also be available on our department YouTube site, as well as the presentation from March on mobility and fall prevention. Thank you so much, Jean and Cheryl, for joining us. Thank you, Dr. Hartzell and Dr. England, for taking the time to share with us. This has been very informative, and I just appreciate you both.
Our pleasure. Thank you so much, Susan.
bye.
Bye-bye.
Thanks for watching. For more information, visit us online, send us an email, or give us a call. Don't forget to click subscribe and hit that notification bell so you know when new videos are released. And most of all, be well.